Okay. All right, we're going to get started. Assalamu alaikum, peace and greetings, my sisters and brothers. My name is Dr. Debbie Almontasser. I am the CEO and founder of Bridging Cultures Group, a company that provides opportunities for people to bridge the gap through multiple pathways. And today, you have been invited for this very important webinar that is going to be sharing vital information, specifically the launch and unveiling of OurHealthNYC. So I want to thank all the faith leaders, the policymakers, the civic leaders, and everyone who's actually signed up to join us this morning for an incredible morning that I promise you by the end of the hour that you are going to say that you are happy to spend this hour with us. So what I want to do is review the agenda with you, if we can get that on the screen, and I will be happy to share with you what we are going to do this morning. Right now, we're doing welcomes and introductions, which my dear colleague, Mr. Bruce Dane, will be joining you in a couple of minutes. We have our featured speakers, Dr. Syra Madad, Councilman Mark Levine, and Sheikh Musa Drama. Then we will have the unveiling of OurHealthNYC by Dr. Omar Lattouf. We have two guest speakers, Rabbi Sharon Kleinbaum and Reverend Winkler, who will be joining us this morning. And then we're going to open it up to Q&A and next steps. And I also want to take the opportunity to acknowledge our sponsors, the National Arab American Medical Association, NAMA, Georgia Chapter, Health First, and Bridging Cultures Group. And so without further ado, I want to invite my colleague, Bruce Dane, who will kick us off with the program and also say a few welcoming remarks.
Thank you, Dr. Debbie. We are thrilled to be hosting you today. Like Dr. Debbie said, my name is Bruce Dane. I'm the Executive Director of OurHealthNYC. We have a webinar full of New York City's most influential people. In our pre-webinar interviews with just our panelists, I found myself bursting with admiration and between us, a little intimidated. And they are just so fabulous. And let me add my 2 cents to what they're going to tell you. Although we live in strange and uncertain times, we also live in a world where there is nearly unimaginable innovation, especially in regards to remote health monitoring and the world of medicine. And as you'll hear from our speakers, there's now a political will and the societal inclinations to embrace the good and productive from these healthcare and medical advancements. I am excited about Dr. Lattouf's vision that he's going to outline later in the webinar for OurHealthNYC, but I know enough that it will take the entire village we call New York City to execute. And we will be needing your help, and we'll address that later, but we really will need the help from everybody here. So without further ado and without any more explanation, let me introduce you to one of our panelists, and it's Dr. Syra Madad. And Dr. Syra Madad is a nationally recognized public health leader and epidemiologist in infectious disease and special pathogens preparedness and response. Featured in Fortune 40 Under 40 list of most influential in healthcare. She's the Senior Director, System-Wide Special Pathogens Program at New York City Health Plus Hospitals, the nation's largest municipal healthcare delivery system. Principal Investigator of New York City Health Plus Hospital Institute for Diseases and Disaster Management, Health and Safety Lead on the Enhancement Investigation Unit of NYC Test and Trace Corporation, and core faculty at the National Emerging Special Pathogens Training and Educational Center. Dr. Madad is also a fellow at Harvard Kennedy School's Belfer Center for Science and International Affairs, and a member of the COVID-19 Task Force at the Federation of American Scientists. She has responded to and led multiple infectious disease outbreaks, including Ebola, Zika, measles, and currently COVID-19. Dr. Madad has been featured in 2 leading documentaries, the Netflix series Pandemic, How to Prevent an Outbreak, and Discovery documentary, The Vaccine, Conquering COVID. Dr. Madad.
Thank you so much for that kind introduction. It's a pleasure to be here with you all. And I'm just going to take a couple of minutes to talk about what the COVID-19 pandemic has highlighted and, what we need to do moving forward to close the gap and address a lot of the inequities and disparities that have been seen. So I think first starting off, we know that the COVID-19 pandemic has had a disproportionate impact on a number of different groups. And it has not been the great equalizer as we first thought. And we know that it's not the virus that's discriminating, it's the systems and the structures, it's the institutions that we have is what's causing, a lot of the discrimination that we've been seeing. And so I think first, when we talk about the COVID-19 pandemic, we're seeing that it has not only shed a spotlight on the health disparities and health inequities, and both of those terms mean very, very different things, but it's also exacerbated both of those two. And so it behooves us to know that these issues exist and that we need to do something about them. And when we look at what we need to do about them, we need to look at it in terms of short-term and long-term. Everything that we have done really from just a healthcare and public health approach sometimes has often seemed as if it was bubblegum and Band-Aids. And what I mean by that, it's stop the bleed, but it doesn't completely heal the wound. And so we need to make sure that the solutions that we're looking at today, both from a short-term and from a long-term perspective, is getting to both of those. So from a short-term, we know that, for example, the COVID-19 pandemic is right now. And as we're on the path to recovery, we're seeing so many disparities, inequities as relates to the vaccine rollout. So what can we do to ensure that everybody has access to it and that we're able to get it to as many people as possible? So there needs to be targeted interventions that are looking at that in particular, along with preventative, right? And so when we talk about preventative, we want to make sure that we're providing preventative education. One of the biggest problems that we've seen in this pandemic, and this is not new to this pandemic, it's really from all the different outbreaks we've responded to, is that we're always responding to outbreaks, right? We're never looking at it from a preventative standpoint. We need to invest more in prevention to ensure that we're not always just in the response mode. And so that's where we can obviously not only save as many lives, but we can also make sure that we are able to fix a lot of the longstanding issues that we have seen. And so we need to look at it from that standpoint. We also know that when we look at public health, we have a system that is broken in a sense that we need to finance it in a way that, again, looks at prevention and not so much focusing on response. And certainly when we are in response mode, we need to sustain the infrastructure that we have. And so again, we need to look at it from a short term, and we also needed to look at it from a long-term perspective. If we look at some of the data that this pandemic has shown us, it's showing a huge disproportionate impact on, for example, people of color and minorities. And myself being a minority, and my parents, for example, I have to often accompany my mother to her appointments when I'm in Maryland or when my siblings are there. And that speaks to, when we look at healthcare services, we need to make sure that we're providing healthcare services that is culturally competent, that we can provide language services that individuals feel comfortable in voicing their concerns, that they can walk away with understanding what they need to do, both from a prevention standpoint, as well as from making sure that from a healthcare service standpoint, whatever issues they're coming in with, we're able to address them. And so there's a lot of work that needs to be done. And this is not just on making sure that the work that we're doing is people focused. We need to also look at the systems and institutions. We need to start looking at it from a reform standpoint. What do we need to make sure that from a curriculum and content standpoint, that we're providing more education and training that is, again, more culturally competent, that is informed through trauma-informed care, that we can look at the health literacy and make sure that we are looking at it from a standpoint of how can we elevate that and make sure that our patients and the community members that we serve understand what is happening and be there, boots on the ground. The last thing that I'll mention is, I have the privilege of being part of New York City Health and Hospitals. And one of the, the missions is caring for the sickest of the sickest, poorest of the poorest, regardless of the ability to pay. And we know that when we look at healthcare services, we need to make sure that it is accessible and free to everybody. And a lot of times when we look at some of the barriers and the access issues, we look at cost, we look at access in terms of how close or how far some of these healthcare services are. Sometimes people are not able to go in person. So making sure that we have healthcare services, for example, that we can provide remotely, again, from a lens of not only prevention, but also looking at it from kind of the whole paradigm. When we look at disasters, we look at it from a phase of containment, mitigation, response, and recovery. And so we need to look at it from a lens of what can we do in all these different phases from a people-focused approach. And the last thing that I'll mention before I hand it off is that, you know, the approach that this institution, this organization is taking through the One Health is really, really important, and it embraces a lot of those guiding principles in terms of providing that cultural competency, that trauma-informed care, bringing resources to the people, and that's exactly what we need.
Thank you, Dr. Madad. We are so delighted to have you today and your expertise. Thank you for joining us, and I hope you will stick around for the Q&A. Our next speaker, and this is, you know, incredibly important for everyone to know, is the City Council member, Mark Levine. Mark Levine is the City Council member who represents the 7th District in Upper Manhattan, serving as the chair of the Council Committee for Health since 2017. Council member Levine has been a leading voice in the city's response to the COVID-19 pandemic. While in the City Council, he has been a leader on many issues, including housing, transportation, education, economic justice, and the environment. Throughout the whole entire pandemic, the one place that I have gotten my up-to-date news on the pandemic has been through Councilman Mark Levine, and we truly appreciate you for taking the time to be with us, Council member, and you are on. Take it away.
Thank you so much, Dr. Debbie, for including me in this conversation, and more importantly, for the work that you have done to stand up for the marginalized communities which have been so brutally impacted by this pandemic. Thank you for standing up for public health today for all New Yorkers. I'm really honored to be part of this conversation with Dr. Lattouf, who is providing incredible service in my council district, in a hospital in my district, but more importantly, standing up for public health citywide. And great to be here with you, Dr. Madad, Mr. Drame, and of course, Bruce as well. This is a pandemic which has both revealed longstanding inequality in healthcare and exacerbated that inequality. It's made it worse. And many of the problems that we're speaking about today, sadly, are not new. There has been a challenge for immigrant communities in this city to access quality, multilingual, culturally responsive healthcare for decades. And it has led to some of the inequality in underlying conditions that have resulted in such a brutal impact on immigrant communities, communities of color in New York City over the past year. And unfortunately, some of those same barriers have also directly impacted our city's ability to respond to this pandemic. It does still remain too difficult to access multilingual health services. That's true in every language beyond English, though particularly for languages beyond Spanish, it is extremely difficult to access multilingual staff in Arabic and French, and Hindi and Bengali and Cantonese, and many languages which collectively are spoken as the primary language of hundreds of thousands, if not more, people in New York City. And so I want to add my voice to those who are uplifting the power of healthcare, which is rooted in the cultural and linguistic diversity of the city, both for primary medical care and public health workers who are out there in communities working on prevention before we get to the more acute phase. I also want to speak about the problem of physically accessing hospitals and other in-person medical providers historically and during this pandemic, when, because of the scale of this health crisis, it often wasn't possible for vulnerable people to leave their apartment and go to a traditional medical provider in person. And that has further exacerbated the health outcomes that low-income communities have suffered, even beyond COVID. I want to emphasize the extent to which a wide array of health conditions we have seen setbacks over the past year, because it's been difficult to access traditional care in person for someone managing diabetes, for example, for someone managing a mental health challenge, because either because the system was entirely reoriented to COVID, because of risk to infection and other barriers. And so this really calls attention to the need to provide people medical care via online and telephone, so that at times when the normal hospital system is otherwise inaccessible, and frankly, always, we can reach people where they are in their homes. And it's hard to find a lot of upside in this terrible pandemic year, but I do feel like this has been our moment to open up the possibilities for telemedicine, and that New Yorkers are embracing it now, and that the medical community has transitioned now, that the infrastructure is growing. And so I really want to applaud you, Dr. Lattouf, and the rest of this team in One Health NYC for focusing on the potential of taking this further, both to get us out of this crisis where we need to reach people who are home, to identify problems early, to provide them care when they can't safely get to a physical location, but also, I think, to build a new health system going forward in which telemedicine will be a permanent part of the landscape. If we can do that, that will be one of the few positive outcomes to come out of this. So I really want to commend this coalition for pushing technologies and strategies, both to expand multilingual, multicultural, culturally competent care, and to find innovative new ways to reach people when they can't or won't come in to a traditional medical facility. Thank you so much for this work, for convening us today. And thank you, Dr. Debbie, for your voice on public health and so much else, and for including me in this important discussion today. Thank you so much.
You're very welcome. I hope you'll be able to stay for Q&A, Mark.
I will. I might have my camera off because I'm going to be moving around, but I'll be here.
Okay, thank you.
Okay, thank you.
Wonderful. And I'll add my thanks. Thank you, Councilman Levine. That is so great. And we appreciate your support. You and your office have been wonderful to work with as we've been putting together this event. So now I want to introduce Sheikh Musa Drama. Sheikh Musa Drama is the founder of Muslim Media Corporation, the publisher of Muslim Community Report, New York Parrot, and Parkchester Times newspaper, and the CEO, let me say that again, and CEO of HelloFinder.com. Mr. Drama's passion for entrepreneurial development hails from his decades in the area of real estate, insurance, and investment banking industries on Wall Street. He is a community organizer who has led and inspired many other community, religious, and educational initiatives through which he and his colleagues have received a number of proclamations from elected officials. Mr. Drama executive produces Muslim Community Report and Public Emergency Management Adherence television shows on Broxnet Television, and is a frequent media commentator on Islamic issues and African immigrant affairs. Sheikh Drama, you are now up.
Good morning and greetings, and thank you, Bruce. Thank you, Debbie, and thank you, Dr. Lattouf, and thank you, Angelo. And it is my honor, to be invited here today. And thank you for putting a program where you have highly qualified speakers and highly unqualified speakers. So I am now filling that position. Anyway, my name is Sheikh Musa Drame. I am, living in the Bronx. And as you can tell, I represent, 3 disadvantaged criteria in New York City. Number one, most of the people that I represent are immigrants. Number 2, all of them are minorities. And number 3, they do live in the Bronx. And Bronx has been consistently ranked 62nd out of the 62 New York State counties, meaning that this pandemic to us is a year-round pandemic, unfortunately. So having such a program that you conceived and you're launching to be very relevant to our languages, to be very relevant to our cultural practices, to be able to meet people where they are and to communicate with them the way that they're comfortably able to receive the information is absolutely a necessity. And this pandemic has been the worst experience in my life, in my community, and in the border that I live. By May of last year, the African community have lost so much individuals. We did not know who was going to survive and who was not. I mean, it was so devastating by the month of May that we were all praying and we were all scared. And to top it off, because we come from, backgrounds where we frequently encountered bad medicine and unfortunately conspiracy theories. They were, saturated messages through emails and social medias and even in the newspapers advising Africans not to take any vaccine because, and some of them were highly respected individuals. Some of them actually were doctors and scientists and making out these stories that scare the hell out of people to participate into any medicine. To a point where I started, communicating, with the public. Every Friday, I launch a program just to remind, my audience that we must listen to the health authorities' guidelines. We must refrain from listening to those who are really giving us bad advice. And that Friday reminder became a very popular program. And, thankfully, it had guided so many religious leaders to know that the messages that were being peddled were very harmful, very deadly. And therefore, we needed some type of, counter, attack to them. And I'm excited that we were able to do that. Having our One Health NYC will serve the same purpose because we live in a city of immigrants. As much as we have all the services available, there are many, many communities that are still insulated in many different things. And this may be because of language barriers, this may be because of trust, this may be because of cultural relevancy. Because again, we come from environments where you don't usually trust your government. You don't usually trust, a lot of the officials that you deal with. So those kinds of attitudes and backgrounds, unfortunately, can be very destructive because it hinders, our ability to benefit from whatever that is available to help us. So one of the things that I am very, very proud of is the fact that out of every desperation, intellectuals come up with some innovative way of taking the ball one notch up. And I think our Health NYC is that out of desperation, you come with a very innovative, very relevant, something that can save lives, something that can only help, the public, but also help the government and lessen the healthcare costs. And I will also say one thing about this particular program. Couple of years ago, as a person in the media, I did a test at my mosque. I brought a story from a New York Times, and we read it. It was about issues in the Middle East. And, they said, oh, no, this is all propaganda. This is not true. The following day, I brought the story in the Arabic newspaper because it was an AP originated story. Same story one is English, one is Arabic. So when the Imam read the story in Arabic, everybody was praising it, because to them, if it's an Arabic language, it is true. And if it's English, it's a propaganda. So that is why our Healthy NYC is extremely important. We have so many wonderful services in New York City, but reaching to these insulated communities still a major problem. Bronx borough is no different, if not worse. So I'm excited to be here, and whatever role that I can play to get the message out, please, you can count on me. Thank you for inviting me, and God bless you, and let's make it happen. Thank you.
Thank you so much. Thank you so much, Sheikh Musa. We really appreciate you, appreciate the stories that you've shared. It is so important that we have you as an ally, especially because you are in Brooklyn. And now, ladies and gentlemen, for the moment that we have all been waiting for, and that is the unveiling of Our Health NYC. I have the great honor and pleasure to introduce Dr. Omar Lattouf. Before I give you his distinguished bio, I want to share with you how this all came about. Dr. Lattouf, through a mutual friend, was connected to me, and here we are today. So I'm grateful to Aisha Jamana, and grateful to Dr. Lattouf for having an interest in the Yemeni community to reach out, and mashallah, it's been an incredible experience. So Dr. Omar Lattouf is senior surgeon at Mount Sinai Morningside Hospital, professor emeritus of Emory University, fellow of Harvard Medical School, dedicated educator, mentor, researcher, and surgeon who has trained hundreds of doctors and nurses. During his career, Dr. Lattouf has performed thousands of complex, life-saving heart transplants and other complex heart procedures. He has lectured in over 30 countries, developed new procedures and concepts in medicine and surgery, and has had lifelong interest in the application of telehealth and artificial intelligence to improve population health. Dr. Lattouf is a member of many professional organizations. He currently serves as foundation chair for the National Arab American Medical Association, a key sponsor of Our Health NYC. It is my great honor and privilege to present to you Dr. Omar Lattouf to unveil Our Health NYC. Take it away, Dr. Omar.
Dr. Debbie, thank you very much for the kind introduction. The honor indeed is all mine to have had the privilege and the opportunity to work with you and your team, to work with Angelo and Bruce, and to be on the same panel with such distinguished speakers, Dr. Maddad, Councilman Levine, and Sheikh Musa Drama. I am a servant, a healthcare servant for patients. I've done this for many decades. I treasure that. That's a great honor for me to be able to cure patients and treat them. It's truly the work that you have done that has made Our Health NYC possible, through your relations and through the respect that you command in the community that has made this possible. Again, I want to thank Dr. Maddad, Councilman Levine, and Sheikh Musa for the words of wisdom that you have shared with us. We will follow with you. Your words of wisdom will not fall on deaf ears. We look forward to seek your counsel and advice. A year ago, I moved to New York City after accepting a job at Mount Sinai Morningside Hospital several months earlier, long before anyone knew anything about COVID. My wife and I had decided to come to New York to spend time with our children and our newborn children. On the first day of my arrival at Mount Sinai Morningside to work with my lifelong partner, Dr. John Puskas, whom I've worked with for the prior 25 years. I arrived on the day that all of the opera rooms were shut down, and for the next 2 months, I did not do a single heart operation. I became an intensivist in a COVID intensive care unit. And I lived like the rest of us New Yorkers through the pains and agony of seeing people dying from a disease that we did not know how best to treat. And through March, April, and May, we saw so many patients die. As I looked at the patient population, sadly, the highest death rate was among patients who coming from communities of color. That experience prompted me to examine how best can I serve my new city, New York City. This led me in October 2020 to chair the National Arab American Medical Association 41st International Conference under the title Surviving the Pandemic, which was attended by hundreds of thought leaders from around the globe. From that conference, I learned the following. I learned that healthcare is a lot more than a doctor treating a patient. I learned, as the Honorable Talal Abu Ghazala, a keynote speaker, said, the old world order is over. We have a new COVID world order. I learned that the future strategies for healthcare, as Councilman Levine said, should be much different than the way we conducted it in the past. And I also learned that healthcare is the glue that ties everything together. And when healthcare fails, everything else follows. We all know too well that New York City was hit very hard by COVID with hundreds of thousands of cases and tens of thousands of fatalities. As I investigated further, and to the point that Sheikh Musa has said, I found out that 1 of every 3 citizens of New York is an immigrant, and many don't speak English. I further learned that Bronx has 500,000 immigrants, and nearly 1 of every 4 contracted the illness, and about 6,000 people died. Those are painful statistics. This data made me reflect, how could I help my city? As I reached for answers, I was introduced with my good luck to Dr. Debbie and her team. Reflecting back on the NAMA conference, Surviving the Pandemic, we concluded that the future of healthcare should be based on bringing broad community engagement from the following segments of the society. 1, policymaker. We're honored and delighted to have Council Levine with us. Patients and their representatives, we're delighted to have Sheikh Musa with us. Civic and Faith Organization leaders and healthcare thought leaders, we're delighted to have Dr. Maddad with us. After months of deliberations, we concluded that we need to develop OurHealthNYC in order to provide health education and remote health monitoring to the most vulnerable communities of New York. We will use innovative technology and connectivity through culturally and linguistically sensitive ways to care for every patient. We shall aim to improve the lives of New York City's communities of color and everybody by providing services in languages they understand. We will deliver this care by providing webinars and other educational material in languages patients will understand and with expression of respect to their culture. We will deploy devices that enable remote patient monitoring. I'm delighted to say that in our audience today, we have representatives from 2 leading companies that have expertise in remote patient monitoring. We will offer 3 levels of care. The first level is virtual care, where we will implement artificial intelligence that interacts on health matters with each patient through artificial voice and text. This is actually functional today and in New York to a limited extent. The second level is to utilize a suite of equipment that monitors patients' vital signs in order to provide customized health strategy. This system allows one-on-one patient and physician interaction via built-in HIPAA-compliant and secure video. The third level, when a patient gets sick, of those we monitor, we will instruct them to come into the hospital where all of the information on them will be available on hand, and we can promptly take care of patients long before they get very sick. We ask you to partner with us. Refer to our services those patients who need our care. Connect us to funders. We need funding in order to provide free care to the underprivileged and patients who are most vulnerable. We asked hospitals to become our institutional partner. And I'm delighted to say that in my engagement with the president of my hospital, Mr. Jinali, he has expressed interest for Mount Sinai Morningside to be a partner in our initiative. Furthermore, I have spoken with the Chief of Clinical Cardiology, Dr. Joe Puma, and the Chief of Cardiac Surgery, Dr. John Puskas, and all of them are always interested in providing care to the sickest of our patients. I asked physicians, nurses, and our healthcare providers to share their talent and expertise, particularly those who command languages that are needed in the community, and to follow on the points that my three prior distinguished speakers said. The community of New York speaks so many languages, and we need healthcare providers who can interact with our patients. Be our eyes and ears. Tell us how we're doing. Give us guidance to where we should go. I invite you to connect with us through email and social media. New York has always been the greatest city in the world. Together, let us make New York City the greatest healthcare city in the world. Let us develop a new model of care that other cities would follow. Thank you very much.
Thank you, Dr. Lattouf. Thank you so much. We are so delighted and honored to have you and to have this incredible idea that you have brought to the world become a reality for New Yorkers. I wish it were here 1 year ago. Maybe the fate of our communities would have been much different. So now I'll pass it on to Bruce, who will actually introduce the next segment, and then we will open it up for Q&A.
Thank you, Dr. Debbie, and thank you, Dr. Lattouf. It's always been great. We've worked on this project together now for nearly half a year, and so I'm looking forward to this launch and the execution of all our planning. At the moment, I want to introduce two faith leaders. I want to introduce our first speaker, who is Rabbi Sharon Clodbaum, serves as a spiritual leader for Congregation Beit Simchat Torah. Rabbi, you are up.
I'm so moved to be here today with all of you celebrating the launch of OurHealthNYC. It is vitally important that all of us come together from the many different faith traditions we represent, from the different communities we inhabit, to demand and to ensure that every New Yorker gets the health care that is needed. We respect the importance of making sure that uninsured and undocumented folks get everything that's needed for a good health care system. In these days, we Jews are celebrating the moments leading up to the holiday of Passover, which is a very holy season for us, starting this Saturday night. In this time, we celebrate our liberation from slavery so many years ago. But we're told to observe these days as if we are living through it now, because we must remember that each of us goes on a journey with God's help from oppression to liberation. And we need the help of others around us to go on our journeys, and we need the blessings of God. So I pray for the success of this wonderful new effort, and I commit myself and our community to do everything to make it successful. And I pray that God is with each of you, making sure that this launch creates new and vitally important services in languages and in cultures that have not been served adequately up until now. My blessings to all of you.
Thank you, thank you, Rabbi Clodbaum, for your emphatic endorsement and for your introduction of our initiative. Our next speaker is James Winkler. He is the President and General Secretary of the National Council of Churches. Jim.
I'm honored to support the launch of OurHealthNYC, and I thank Dr. Omar Lattouf for bringing together policymakers and thought leaders from faith organizations, healthcare and patient representatives to create a task force to combat COVID and advocate equity in healthcare. My name is Jim Winkler, and I serve as president of the National Council of Churches, which is comprised of 38 Christian denominations made up of some 30 million Christians in more than 100,000 local congregations around the country, including many in New York City. The National Council of Churches includes mainline churches, historic Black churches, Orthodox churches, and peace churches. Our Health NYC points that it is the community of colors that have suffered the most. Your vision statement to increase engagement with NYC's most vulnerable through culturally appropriate education and partnerships that will improve their health, reduce their costs, and increase the efficiency of healthcare services in NYC is one we at the National Council of Churches affirm and support. Thank you for what you are doing.
Thank you, Rabbi, and thank you, Jim Winkler, for your endorsement and incredible comments that really support what Dr. Lattouf is doing, what Our Health NYC will be doing for New York City. We are now at the question and answer portion of the program. If you have a question, please raise your hand and Angela will let you come on the screen. I ask you to please keep your question very brief, and if it's a comment, very brief, so we can get as many questions answered. In addition, we also have the question and answer box. If you want to drop a question there, we'll be happy to read it and have it answered. So thank you again all for coming and joining us today for this incredible unveiling of Our Health NYC. I see a question here in the chat. I'll read it until we see hands. What role do you need researchers to play to support the work? Dr. Lattouf, if you'd like to answer that. You're on mute. Unmute yourself.
A great question. Thank you very much for asking that question. There are multiple pathways where we can use researchers. Certainly, we want to know from a demographic standpoint, where are the areas that we need to pay attention to? How can we reach to the patient populations that we need to provide care for? How do we prove that the quality of care lifts up those patients that we want to serve? How do we know that the communication system that we have and the suite of remote diagnostics is providing improved quality care and reduce the care for patients? And at the end of the day, we want to publish all that information so that we can justify that we are doing the right thing or modify our approach.
Thank you. That question came from Allison Squires. Thank you, Allison. We will make sure to connect with you. Our next question is from Robert Morrison. Has New York City identified the zip codes and neighborhoods that have the most disproportionate amount of healthcare needing public health care? Maybe that could be answered by Councilman Levine.
Yes, I'm happy to address that. Apologize for being camera off. The city has actually identified 33 communities that are highest risk and lowest resource, that they're focusing testing and outreach on right now, and that could serve as a good starting point for the kinds of communities that need the assistance of this initiative in the early stage.
Thank you. Our next question is, in what ways can faith communities be involved? This is Reverend Dr. Lauren Russell.
Dr. Debbie, why don't I take that?
Yeah, go ahead.
So it is important and it's vital for this organization that we reach the people that need our help and our services the most. And one thing that we recognize is that so many faith leaders have so much on their plate already. And you have the well-being of your congregation. You have people that are under stress and under duress. And what we want to do is partner with you and make your administration and your service a little bit easier. So when you talk to your congregations and you talk to the people in your faith, that there's one less thing that you have to concern. You can give them a card, give them our information, and then we will help you take care of that person. So what we need from you is to know, we need to know what services are most needed at the local level. What do members of your congregations, what are they suffering from, and what's impeding them from getting service? So we are really, really keen to work with the faith leaders, the community leaders of New York City to make sure that we get, so the people that need the service know that it's there and we know how to connect with them.
So in a nutshell, refer OurHealthNYC to all your congregation members.
Like Dr. Debbie said.
Yes. The next question, which is being posed anonymously. I am a New York City retiree. During the pandemic, I was told that my secondary insurance provider does not pay for virtual visits. Does Medicare, my primary insurance, cover virtual visits?
I'm not sure that I'm qualified to answer that question. I do not know.
So I can say one thing from all of the the meetings that we've had in the development of this organization, that no one is going to get turned away. This is, an organization that has been developed for individuals who might have issues with their insurance, or they may not be insured, or they may be undocumented and too afraid to get medical care. OurHealthNYC will be a refuge for individuals in those situations as well.
Hey, Dr. Debbie, one of our partners from Vital Tech, Rick Warren, says that those services are absolutely covered. So I think that at the moment we can't speak too much to it. We seem to think that it is covered, and we can provide more information on our website in the weeks to come.
Great. Our next question is from Morgan Shansk. Morgan, from the nonprofit organization Brooklyn Center for Quality Life. How will you address the disparities in each of the boroughs? Will you form separate coalitions by boroughs? How can local community-based organizations fit in?
Well, so let me take a stab. You, I think, are asking a question that is very advanced and is very far thinking. And I think that our goal is to serve each borough and each community in the way it needs to be served, in the language it needs to be served, and being culturally sensitive to the community there. So I don't know at the moment if we made any plans for one borough over another, but we will be working with the leaders, and we will need your help as we map out our next steps and our action items.
And we love the idea that you're giving about having borough coalitions.
Yeah, it's fabulous.
Dr. Lattouf, did you want to add?
I want to follow and say a very important question. We look forward to go and be there on the ground to meet people and to hear from them and to create those coalitions. And I want to go back to the original title of our initiative. It was Task Force for Better Health. So we look forward to create task forces in different boroughs that connect with us.
Great. The next question is from Ahmad Shabib. How are you going to fund this project?
Well, I want to take that. I want to recognize Dr. Ahmad Shabib, the president of the National Arab American Medical Association. It's his vision and support, the very early support in endorsing this concept and making a substantial donation that made our initiative work. We will partner with organizations like NAMA and like other organizations so that collectively we can serve our target community. Our objective is to identify partners, work with them, and I'm delighted to say that since we have popularized this idea through small circles, we're getting requests for information from Chicago, Atlanta, Michigan on how can they create Our Health Atlanta, and likewise.
Wonderful. We have two last questions. I'll read the first one. It's anonymous. Great initiative. What type of remote jobs will be created and when are you looking for support?
Bruce?
So I cannot speak to the remote jobs at the moment, but I can speak to the support we're looking for. We are looking for support within the community leaders, which we just discussed, but we're also looking for support with within the healthcare industry and the large organizations that are serving that industry. We are looking for support amongst other industries and other large corporate sponsors. We will also be working to secure government grants. So at the moment, I don't know if we have any concrete plans on hiring, but I know that this is going to require a lot of people to implement and to execute. So that is definitely something we will be doing, and that will also be listed on our website.
And the last question is, what's the best email to reach out for partnerships? Angela, if you can put up that last slide for the email so people could see them, that would be great. And I urge everyone to actually take their cell phone out and take a picture of that last slide. There you go. You have here Dr. Lattouf's email address and Bruce's email address and the website information. Thank you all for the important questions that you have asked us. It has been a pleasure. Now we are up to the last portion of our program, which is next steps, and next steps will actually be discussed by Bruce.
So I want to thank all of our panelists. It's been such an education for me personally. So I want to thank all our experts. I want to thank Dr. Lattouf, of course, Dr. Debbie and her team. And I want to thank the questions that were asked. And it was fascinating to see where people went where their thinking went to so quickly. So that is also going to help us as we plan our next steps. But let me say that I'm honored to be on this program with so many good and hardworking people that are trying to do what's best. And once again, I thank everybody for the questions that came in. So next steps, we have a fabulous new website, and it is OurHealthNYC. So if I would just ask everyone to go to the website, poke around, you can see a little bit more about our mission and our vision, how we plan to execute to a degree. Also has our communication, how to communicate with us, and just a little bit more information about the organization. And then to our faith-based leaders and to our community leaders, once again, we want to engage, we want to learn about your needs, and we want to be an organization that makes your life easier and makes the life of your congregations easier. So we want to communicate with you, and we want to see what you need from us. And then lastly, if you are represent the interests of a large organization or business, we would love to partner with you and discuss ways that with your sponsorship and with your partnership donation, how we can help you in turn. So please go to our website. There's information on how to donate. There's information on how to get to us and a little bit more information about the organization. Also, if about any community and faith leaders, we'd love to talk to you. And finally, we'd love to explore those partnership opportunities.
Thank you, Bruce. Well said, and we are so excited. It has been really an incredible pleasure to work with you and Dr. Lattouf to bring this seed idea into a reality that is going to make a difference in New York City. We are going to build it one step at a time. We appreciate everyone who has actually joined us this morning. We know that you all have very busy schedules. But you took the time to be here with us for an hour. I want to thank all the faith leaders, the civic leaders, the policymakers, and community members, as well as healthcare providers. I want to shout out again our sponsors who, we couldn't have done this without them. The National Arab American Medical Association, the NAMA chapter, Health First, and You Beyond for also being sponsors for today. I want to thank Dr. Lattouf. I want to thank Bruce. and our distinguished speakers. Dr. Madad, we know that you are one of the most busiest people in New York City, probably in the country, after Dr. Fucci. Thank you for joining us this morning and shedding such important light on this pandemic and what we can all do. I also want to thank Sheikh Musa Drama for joining us and talking about the impact that COVID-19 has had on his community and New Yorkers, specifically communities of color. And last but not least, Councilman Mark Levine for joining us and really giving us a snapshot of what is happening in our city and how we can work together to make sure that we meet these needs. Thank you all for joining us, and we will see you next time. You have all of the information here to reach Dr. Lattouf, to reach Bruce. We will also be sending a follow-up email with this information so that way you can make sure to stay connected with them. We welcome all of your ideas on how we can make this an organization that will serve every person in New York City who needs healthcare. And through the educational webinars that we will be presenting, we want your talent and we want you to come and share with us. If you speak languages that are not being addressed or provided by New York City, please reach out, because those are the communities we want to target. There is no interest here in replicating what the city is doing. What we want to do with Our Health NYC is supplement what the city is doing and really addressing those communities that cannot be reached by New York City Health Services. So on that note, thank you all so much again, and stay tuned for more information from Our Health NYC. Thank you all and have a great afternoon.
Thank you.
Thank you.